and thank you all for joining us again today. We're going to do this the same format as we have been doing, with one exception. After much feedback, we are going to have the media come to this mic right here after you've been called on to ask one question. So make it good. First, we're going to start with Mayor Dan Polk.
Good evening. I apologize on being a minute or two late starting. I think it's important, though, that we get this right. And this situation, continues to evolve. I want to start by saying we're not surprised by the fact that we've had positive cases. We told you 10 days ago to expect that, and that's coming to fruition. So in that regard, I think that's good news. Yesterday, we discussed new testing options that would be available in our community that began yesterday, such as the DriveThru Clinic at University Medical Center. Starting today, the City of Lubbock Public Health Department receives results not only from the local LRN lab where we've been doing our testing, but also from local providers using private labs. The LRN results are still reported directly to our public health department by 5:30 p.m. However, results from the private labs are reported directly back to the local provider, who must then notify the public health department. Private lab results are provided as they're processed, which means they come back to Lubbock at different times and potentially, or maybe say likely, to different providers. The providers must report any positive results to the public health department. Then we must verify the patient, notify the state before we can make an announcement. To accommodate the more rapid availability of test results, we're revising our protocol to notify the public. We'll notify the public through a press release after a positive test positive test results are received, verified, and the state notification is completed. We still intend to do that within 2 hours of receiving those results. This could result in multiple press releases during the day, or any single day. We still plan to hold a single press conference for now at 6 p.m. during the week, and as needed on the weekends, to present new information and to follow up on prior cases. We'll reevaluate our press conference frequency next week, and probably on Monday night at 6 o'clock when would be our weekly presser. And with any daily information, we will be able to give you that information then. If by chance we need to do a press conference tomorrow, it's going to have to be out at Lubbock Fire and Rescue, because this building is being deep cleaned, sanitized tomorrow. If we do one on Sunday, it'll be back here Sunday afternoon, Sunday evening, and I would say there's a pretty good chance that could happen on Sunday. I wanted to make these statements up front because this changes the way the information came out today was was different, and I had a few of you reach out to me and say, "This is not what you told us it was going to be like." And with the private testing, that's changed. That's okay. We want the private testing. So I'm going to ask our Director of Public Health, Catherine Wells, to come forward and give you the specific update, followed by our Public Health Authority, Dr. Ron Cook. Ms. Wells?
Thank you, Mayor. Good evening, everybody. Today we received 2 notifications of positive test results. The first one was a 30 to 40-year-old who traveled outside of the country. This individual was actually identified through our case investigation of case number 3. So really through the process, public health process, and that going through and doing contact tracing, we actually go out and do interviews, and we can interview individuals, see if they have any signs and symptoms, and then go ahead and help them obtain testing. So through that contact investigation, we were able to find an additional case in our community. We also received later in the day a second case of a 15 to 25-year-old, and that case investigation is currently ongoing. However, we have identified multiple areas where this person had visited, and those areas include attending a graduation ceremony at Sunset Church of Christ on March 14th, and then there are some visits to local retail establishments on March 16th, and those include the Walmart on Frankfurt, Hobby Lobby, the Market Street on Quaker and 19th Street, and the Dollar General on 34th Street. These were all done during that day, and I have the specific times listed on that chart that you received. I do want to make a couple of comments that all of these retail establishments, our grocery stores, have all done doing lots of work to make sure that they clean high touch points regularly. I was actually on the phone with Market Street, and they were explaining their cleaning process that they started a couple of days ago, and every hour they're hitting all of those high touch points to really prevent the spread of coronavirus. The other important point is that this really shows how important it is for individuals to stay home when they're not feeling well or they have any symptoms. It is so, one person going out to these stores can put other individuals at risk, and you don't know if there's individuals that are out that store that are older or have these comorbidities. So it's so important, so that we don't have to make these notifications about public exposure, that people that are sick stay home. And I'll go ahead and turn this over to Dr. Cook.
Thank you, Catherine. So I want to talk to you about a couple of things. One are the warning signs for those of you that might get sick or the individuals getting sick. Those warning signs, so first of all, let me just say isolation means isolation. That means you need to stay away from people that are sick, unless you're the caregiver. The other thing here is that these warning signs are severe shortness of breath, okay? High temperatures that aren't controlled with Tylenol or acetaminophen. Confusion, if your loved one has confusion, you need to let somebody know. Severe chest pain, severe dehydration, turning blue on the fingertips, around the lips and the mouth, those are all warning signs. You need to call somebody. If you get sick, please call somebody and talk to them. Please call your healthcare provider. Don't go to the ER, okay? Because the ER is going to be full of people to begin with. Please call your provider, and they will help triage and tell you what to do next, okay? And again, isolation means isolation. Let's stay away from people. This is that social distancing that we need to do effective immediately, okay? The other thing, as we begin this social distancing and not being able to do the things that we normally do in our daily routine as far as social interactions concerned, that can be a burden on our health, on our mental health especially. So what things can we do to support our mental health? Some of those things are get on the media, do FaceTime with somebody and have coffee over FaceTime instead of at the shop, right? You know, hold your warm cup of coffee, smell the aroma of the coffee. That's going to help. But I want you to do it through Facebook, not through close interaction with anybody, okay? We got to limit our number of people that we can put and congregate in one area. The other thing is get outside, do exercise. Those things help your physical body stay healthy. The other thing that I want you to do is get out of your pajamas. If you're already staying at home, don't stay in your pajamas all day long. Don't sit in front of the TV all day long. Get up, get outside, get dressed, act like your normal daily routine, and carry on with life as best as possible. And most of all, take one day at a time. Don't let fear overwhelm you. Limit, so I said use Facebook and use social media, those sorts of things, but limit your exposure to that all day long. There are too many armchair quarterbacks on Facebook and other things. Use respected news outlets for appropriate information. There's just way too many armchair quarterbacks on social media. And the last thing I want to leave you with is get out and help somebody else. Run an errand for somebody else. When we're not focusing on ourselves and we're focusing our attention and helping somebody else, that gives us a sense of purpose. And it makes us feel better, and it certainly makes them feel better for those that can't get out and get toilet paper. That's all that I have. Thanks. Mayor.
Thank you, Dr. Cook. Let's change just a topic, same general subject, but less on the cases. As we discussed yesterday, Governor Abbott issued an executive order related to the COVID-19 breakout. This order is in support of the public health disaster declaration issued by Dr. Hellestadt, the Commissioner of Public Health for the state of Texas. That order goes into effect at 11:59 p.m. tonight, March 20th, and runs through April 3rd, 2020, unless it is extended. Tonight, I've issued a third declaration of disaster for the City of Lubbock. This updated declaration brings Lubbock in line with the governor's executive order. All of you will be provided with today's order. I think it looks like you've already gotten it. The operative items are contained in items 3, 4, 5, 6, 7, and 8. Specifically, the declaration will prohibit social gatherings in groups of more than 10 people, eating or drinking at bars, restaurants, and food courts. It also prohibits visiting gyms or massage parlors. Drive-through pickup or delivery options are allowed and are highly encouraged. Visiting nursing homes or retirement, long-term care facilities is also prohibited unless the visit is to provide critical assistance. This declaration does not prohibit the following: visiting places such as grocery stores, gas stations, parks, and banks, so long as necessary precautions are maintained. This declaration does not mandate sheltering in place, or does it restrict any domestic travel. All critical infrastructure remains operational. Government entities and businesses will continue working and providing essential services. For offices and workplaces that remain open, and we talked to a number of businesses today, they need to follow these guidelines and practice good hygiene, and we're encouraging them where feasible to work from home. Our declaration takes effect tonight, as does the governor's, and by this action, it is fully enforceable. The declaration is issued, as I mentioned the other day, under the authority that the charter gives the mayor of the City of Lubbock. Accordingly, this declaration is subject to renewal by our City Council within 7 days, and I will present this declaration to our Lubbock City Council at our regularly scheduled meeting next Tuesday evening, March the 24th. I want to close with three things, all right? First of all, to echo what Dr. Cook said, this doesn't mean you can't go out. In fact, there's some great examples. We've got restaurants that have never done takeout or delivery or certainly curbside that are doing that. There's a lot of creativity there. I was told today of a church that's having their church service this weekend, and you drive to church and park in the parking lot. You can't come inside. They've asked you to go to the bathroom before you come to church, but they're going to stream it to your radio, and you'll be in the parking lot. It's a little bit like going to a drive-in picture, but you're going to get it that way. I think it's creative. I think it creates a bit of a sense of community. I applaud that kind of effort. Second, I want to piggyback on what Dr. Mitchell said last night on his video on social media. If you've not seen it, I hope you'll look at it. Spring break does not need to become outbreak. If you're a tech student or a parent of a tech student or an aunt and uncle of a tech student that doesn't live in Lubbock full time, they need to go home. This next week of no school is to allow their faculty to get ready to teach online for the balance of the semester. Finally, and this will play into that point, we take this very seriously. Let me give you two examples. We've already quarantined one of our cases. Case 3, I will ask as soon as the number 3 is when they are released from the hospital, if they're still in the period where they are outside of the danger zone for all of us, I will ask, and I think Dr. Cook will quarantine. We take this very seriously. I know you do too. We've heard from many of you today. We're thankful that you've bought in on this. Once again, our efforts, all of us, are trying to maintain or provide for the safety of the citizens of Lubbock. Thank you for being here tonight. Ms. Nobles.
Okay, I'm going to call on y'all one at a time to come up and ask one question. Karen?
I have two questions. I could sit down and stand up again, but I really have to ask one of these. First of all, the person in Hockley County, can we assume they work in Lubbock, and that's why you were including them with the City of Lubbock's announcement?
That Hockley County case is the case that we announced as the second case being here earlier this week. I need to look and see what the best way to keep that case count or remove it from our actual cases.
But I believe, to clarify,
Yeah.
Hockley County introduced a second case announced a
Yes, they
second
did.
case last night, and that is
No.
not reflected in your,
Correct, yes.
is that correct?
So the second case that was confirmed in Hockley County last night is not on our list because that investigation was not done by the health department here in Lubbock. That will be done by the state health department.
Are there medical people who are, Dr. Cook, who are quarantining themselves because they've had contact with people who have been confirmed or have symptoms?
Well, that's a conversation we can have with them. Any prudent person, especially a physician, if exposed, would self-quarantine them. It doesn't require a written report or edict. They would self-quarantine and remove themselves from practice if they were truly exposed.
And I heard that, sorry, I heard that out of several hundred people who have actually been tested in the drive-through, only one test was actually taken from that group. Is that correct? I mean, actually sent off for testing, or how many do you think were? How many, if I'm wrong, how many do you think were taken?
I don't have it was around 80 or so tests were processed from the initial UMC clinic. I don't have the exact number. And then there was one that was positive from that site, from the drive-through site.
So you already know that all the others were not positive? Only one was positive from all of them?
UMC received results for approximately 80 individuals today.
And only one was positive?
From the drive-through clinic, and only one was positive.
Matt with the AJ. Catherine, can you help us understand how the risks are low and just kind of, you know, if someone went to Walmart, Hobby Lobby, Market Street, all these places, kind of the risks involved in that?
Thank you, Matt. If you look at that second document, the second page of the document that I'm passing out, it defines what a low-risk exposure is. And those are exposures that you could have come in contact with somebody, but it's in a much larger public area. When we're looking at our high-risk and medium-risk exposures, those are people that are living in the same household or are roommates of individuals that are diagnosed with COVID-19. So.
Can we also get a health update on the second patient, the one that's over 60? Can you let us know how he or she is doing?
That case is being followed by the Department of State Health Services, and I don't have that information.
While you're coming forward, I need to add something. I failed to mention something, and there's something that a bit of news we just got. The governor, we heard from the state today, both Health and Human Services, and I believe also then the governor's office, indicating that daycare was not covered by his requirement that closes schools. The second thing, we've just seen not quite as strong of advice, but an interpretation that said that churches are not covered by his executive order, but are strongly recommended to follow the social gathering guidance. I can't speak to anything more than that. It's just fresh news. I had a chance this morning to speak via conference call with many of our faith leaders first thing this morning. None of them pushed back on this being a bad idea. There's a few that wanted some help on ideas on how they would get this to their congregations, particularly the smaller churches, and we provided them some help today on how you'd put something on YouTube or how you might do something along those lines. But just one thing I'd forgotten to mention, one bit of information that just came in.
You mentioned that the fourth case was connected to the third case, correct?
Yes.
Is that community spread, or do they just happen to go to the same out of
They
country?
happened to go on the same trip.
Oh.
Yeah.
Mayor Pope, talking about the governor's order, you mentioned food courts, so that kind of goes in with that limit. What about the South Plains Mall? We've had people wondering if that was going to be open or not.
I'm not sure I can answer the question. I know under our order, the South Plains Mall was closed. I don't know, Mr. Atkinson, what's your read on that?
The food court, that is absolutely.
Certainly, the food court is closed. I guess
The way the order is written, I think it would be impossible for the mall to be open.
that's just one of those situations. That's where people gather, and that's just a spot that we don't need people gathering. We've got to take this seriously, and that's why the governor made that move.
Dr. Skuvenek said that 100 students were traveling abroad. Do you know if this, I hate to say do you know, will you tell us if this 15 to 25-year-old was a Texas Tech student traveling abroad?
Our investigation did not indicate that this individual was a Texas Tech student.
I would add to that the students, the tech students that were traveling abroad, we have a very good bead on who they are. The one that, case number 1, was it case 1? Is that right? That's the one we talked about earlier this week. There are a number of others that followed the protocol and continue to work with the health department, reporting in on temperatures and doing what they've been asked to do. We don't feel like there are problems to date with any of those other students that traveled abroad. The vast majority went back to their homes. Only a few didn't have a place to go and came back to Lubbock.
This is a question, I think, for Dr. Cook. Can you just talk about, so if people have been practicing social distancing and have stayed in their homes, case after case, nationally and locally, can get, I guess, can put people down. Like, what would you say to people who are wondering if it's working or not, or if it's helping or not, staying in their homes and social distancing?
So let me make sure I have the question right. So by this social distancing, are we seeing any effect to slow the disease? The whole purpose of social distancing is to flatten that curve. You remember the slide I had from my first presentation or second presentation? It's the same number of people get sick. We just push them out further so that the total number at any given moment isn't overwhelming our system. This is sort of like you have a drain that doesn't drain very fast and you can only push so much water through the drain. If we don't exceed that amount that can go through the drain, we won't have water backed up. The same thing, if we have too many sick at any given time, we're going to overwhelm the system. We're not going to have enough ventilators. We can't get enough PPE, personal protective equipment, that sort of stuff. So the purpose of social distancing is really to slow the number of people at any given time that are infected. We know historically from other data, other diseases, that it works. It's a little early here. We'll see what happens in California. We'll see what happens in other places, in New York, that have much stricter guidelines on social distancing than we do currently. So hopefully, if we can get all of our participants in Lubbock to play by the rules and keep social distancing at a distance, Reiterate what Mayor Pope said. That doesn't mean you can't go outside and you're quarantined, except for those few individuals that are either self-quarantined by mandate or self-isolation where you shouldn't be going out. But the rest of us can go out, get some sunshine, exercise, fresh air, and watch all the new things bloom that just are going to happen from the rain. So hopefully, we know plenty from past data that this works. I need everybody to do this.
Okay, that's it. Thank you all for coming. We'll let you know this weekend any new updates, and plan on a press conference on Sunday. I'll send out that information this weekend.